Question 1. A patient receiving hemodialysis suddenly experiences shortness of breath, rapid heart rate, and pink, frothy sputum. Which respiratory complication is most likely occurring? A. Pneumonia. B. Asthma exacerbation. C. Pulmonary embolism. D. Pulmonary edema. Answer D. Pulmonary edema. This question tests your understanding of common respiratory complications, especially in hemodialysis patients. The keywords shortness of breath, rapid heart rate, and pink, frothy sputum are classic signs of pulmonary edema, which is fluid accumulation in the lungs. In dialysis patients, this often results from fluid overload that the kidneys cannot excrete, leading to fluid backing up into the lung tissue. Unlike other options, the pink, frothy sputum is a hallmark sign of severe pulmonary edema. Recognizing these symptoms allows for prompt intervention, such as initiating ultrafiltration during dialysis. Here's an easy way to remember. Think P for pink, P for frothy, P for pulmonary edema, especially when fluid overload is a concern. Question 2. Which of the following is considered a normal respiratory rate for an adult at rest? A. 8 to 12 breaths per minute. B. 12 to 20 breaths per minute. C. 20 to 24 breaths per minute. D. 24 to 30 breaths per minute. Answer B. 12 to 20 breaths per minute. This question assesses your knowledge of normal adult vital signs, a fundamental concept for patient assessment. The phrase normal respiratory rate refers to the typical number of breaths per minute in a healthy, resting adult. A rate between 12 and 20 breaths per minute is the accepted range, and any significant deviation might indicate a respiratory issue or other physiological stress. Monitoring respiratory rate is a simple yet crucial part of assessing a patient's overall well-being and can alert you to potential problems. For example, a rate of 25 breaths per minute in a resting patient could signal respiratory distress, like fluid overload, in a dialysis patient. Remember to always count for a full minute for accuracy. Question 3. A patient undergoing hemodialysis complains of increasing dyspnea and appears restless. Their oxygen saturation, SpO2, is 88% on room air. Which action should the dialysis technician anticipate or initiate first? A. Administer a bronchodilator. B. Elevate the head of the bed. C. Obtain an arterial blood gas, ABG. D. Prepare for endotracheal intubation. Answer B. Elevate the head of the bed. This question focuses on immediate interventions for a patient exhibiting signs of respiratory distress and hypoxemia, low blood oxygen. The keywords dyspnea, restless, and SpO2 88% all point to the need for immediate action to improve oxygenation. Elevating the head of the bed helps improve lung expansion and reduces the effort of breathing, making it a quick, non-invasive first step to ease respiratory distress. While other actions might follow, this is the most immediate and universally applicable initial intervention for improving ventilation. For instance, in a patient with fluid overload, this position helps shift fluid away from the lungs. Always prioritize simple, effective, and safe interventions first. Question 4. What is the primary purpose of an incentive spirometer? A. To measure forced expiratory volume. B. To deliver oxygen therapy. C. To encourage deep breathing and prevent atelectasis. D. To clear secretions from the airways. Answer C. To encourage deep breathing and prevent atelectasis. This question evaluates your understanding of a common respiratory therapy device. The keyword incentive spirometer refers to a device used to help patients take slow, deep breaths. Its primary purpose is to prevent atelectasis, which is the collapse of small air sacs, alveoli, in the lungs, by encouraging full lung expansion. By using the spirometer, patients can see their progress, which encourages them to take deeper breaths, improving ventilation and gas exchange. For example, a patient recovering from surgery or who is sedentary can use it to maintain lung health. Remember, deep breaths keep your alveoli open and prevent lung complications. Question 5. Which of the following breath sounds is characterized by a high-pitched, musical, squeaking sound, often heard on expiration, indicative of narrowed airways? A. Crackles, rowels. B. Ronchi. C. Wheezes. D. Pleural friction rub. Answer, C. Wheezes. This question tests your ability to identify common abnormal breath sounds. The description, high-pitched, musical, squeaking sound, often heard on expiration, indicative of narrowed airways, precisely describes wheezes. Wheezing typically occurs when air is forced through narrowed airways, such as during an asthma attack or in chronic obstructive pulmonary disease, COPD. Understanding these sounds helps you recognize respiratory distress and report findings accurately to the nurse. For instance, hearing wheezes on a dialysis patient could indicate a developing respiratory issue or an exacerbation of a pre-existing condition. Differentiating breath sounds is crucial for accurate patient assessment. Question 6. A patient with chronic obstructive pulmonary disease, COPD, is instructed to breathe using pursed lip breathing. What is the main benefit of this technique? A. To increase the intake of oxygen. B. To strengthen the diaphragm muscle. C. To prolong exhalation and prevent airway collapse. D. To clear excess mucus from the airways. Answer, C. To prolong exhalation and prevent airway collapse. This question focuses on a specific breathing technique often taught to patients with obstructive lung diseases like COPD. The concept being tested is the purpose of pursed lip breathing. This technique involves inhaling slowly through the nose and then exhaling slowly through pursed lips, similar to blowing out a candle. This controlled exhalation creates back pressure in the airways, preventing their premature collapse and trapping of air, which is a common problem in COPD. It effectively helps patients empty their lungs more completely, reducing air trapping and shortness of breath. Encourage patients to practice this to manage their breathing. Question 7. What is the primary gas exchanged in the alveoli of the lungs? A. Nitrogen and carbon monoxide. B. Oxygen and carbon dioxide. C. Hydrogen and methane. D. Helium and nitrogen. Answer, B. Oxygen and carbon dioxide. This question covers fundamental respiratory physiology, specifically the process of gas exchange. The alveoli are tiny air sacs in the lungs where the vital exchange of gases occurs between the air and the blood. Oxygen from the inhaled air diffuses across the alveolar capillary membrane into the bloodstream, while carbon dioxide, a waste product from the body's metabolism, diffuses from the blood into the alveoli to be exhaled. This continuous exchange is essential for maintaining life. Think of the alveoli as the body's gas exchange station, where fresh oxygen comes in and waste carbon dioxide goes out. Question 8. A patient on hemodialysis reports sudden, sharp chest pain that worsens with deep inspiration and coughing. This pain could be indicative of A. Bronchitis. B. Pleurisy. C. Emphysema. D. Pneumothorax. Answer, B. Pleurisy. This question assesses your knowledge of chest pain characteristics and their potential causes, particularly relevant when monitoring dialysis patients for complications. The keywords sudden, sharp chest pain that worsens with deep inspiration and coughing are classic signs of pleurisy, which is inflammation of the pleura, the membranes lining the lungs and chest cavity. This inflammation causes the two layers of the pleura to rub against each other during breathing, leading to sharp pain. While other conditions can cause chest pain, this specific description strongly points to pleurisy. Always report such new or worsening symptoms to the nurse immediately. Question 9. What is the recommended position for a patient experiencing severe shortness of breath during a hemodialysis treatment? A. Lying flat on their back, supine. B. Trendelenburg position, head lower than feet. C. High Fowler's position, sitting upright at 60 to 90 degrees. D. Left lateral position, lying on their left side. Answer, C. High Fowler's position, sitting upright at 60 to 90 degrees. This question tests your knowledge of therapeutic positioning for respiratory distress, a critical skill in patient care. The concept is to maximize lung expansion and ease breathing effort. High Fowler's position, where the patient is sitting upright at a 60 to 90 degree angle, allows gravity to pull the abdominal organs down, giving the diaphragm more room to move and improving lung ventilation. Lying flat or in Trendelenburg would worsen shortness of breath by increasing pressure on the lungs. Always help patients with breathing difficulties into an upright position as quickly as safely possible. Question 10. Which of the following symptoms is an early sign of hypoxia in an adult patient? A. Cyanosis. B. Bradycardia. C. Restlessness and anxiety. D. Bradypnea. Answer, C. Restlessness and anxiety. This question evaluates your understanding of the early clinical manifestations of hypoxia, low oxygen levels in the body's tissues. While cyanosis, bluish discoloration, is a late sign, and bradycardia, slow heart rate, and bradypnea, slow breathing, are not typical early responses, restlessness and anxiety are often among the first indicators. When the brain doesn't receive enough oxygen, patients may become agitated, confused, or anxious as their body tries to compensate. Recognizing these subtle initial clues is crucial for prompt intervention and preventing the condition from worsening. Always be vigilant for changes in a patient's mental status. Question 11. What is the primary function of the epiglottis? A. To produce vocal sounds. B. To warm and humidify inhaled air. C. To prevent food and liquid from entering the trachea. D. To filter foreign particles from the air. Answer, C. To prevent food and liquid from entering the trachea. This question tests your knowledge of basic respiratory anatomy and the function of its protective structures. The epiglottis is a leaf-shaped flap of cartilage located at the top of the larynx, voice box. During swallowing, the epiglottis closes over the opening of the trachea, windpipe, effectively diverting food and liquid into the esophagus and preventing aspiration into the lungs. This protective mechanism is vital to prevent choking and pneumonia. Think of the epiglottis as the gatekeeper that ensures food goes down the right pipe. Question 12. When monitoring a patient's oxygen saturation with a pulse oximeter, which finding would be considered normal for a healthy adult? A. 85 to 90%. B. 90 to 94%. C. 95 to 100%. D. Below 85%. Answer, C. 95 to 100%. This question assesses your knowledge of normal pulse oximetry readings, a standard vital sign measurement. A pulse oximeter measures the oxygen saturation, SpO2, of the blood, indicating how well oxygen is being transported. For a healthy adult, an SpO2 reading between 95% and 100% is considered normal and reflects adequate oxygenation. Readings below this range, especially below 90%, may indicate hypoxemia and require immediate attention. Regular monitoring of SpO2 is crucial for assessing a patient's respiratory status, especially in those with underlying conditions. Question 13. Which of the following is a common cause of respiratory acidosis? A. Hyperventilation. B. Diabetic ketoacidosis. C. Hypoventilation. D. Excessive vomiting. Answer: C. Hypoventilation. This question delves into acid-base balance, a critical concept in patient care, especially for dialysis patients. Respiratory acidosis occurs when the lungs cannot adequately remove carbon dioxide, leading to an excess of CO2 in the blood and a decrease in blood pH, making it more acidic. Hypoventilation, or slow/shallow breathing, is the primary cause because it leads to CO2 retention. In contrast, hyperventilation would lead to respiratory alkalosis. Understanding the relationship between breathing and CO2 levels is key to recognizing respiratory distress. Question 14. A patient with a new tracheostomy requires suctioning. What is the primary reason for performing tracheostomy suctioning? A. To stimulate the cough reflex. B. To prevent vocal cord damage. C. To remove accumulated secretions from the airway. D. To administer nebulized medications. Answer: C. To remove accumulated secretions from the airway. This question focuses on the purpose of a common respiratory intervention, tracheostomy suctioning. The primary reason for suctioning a tracheostomy is to clear accumulated mucus and secretions from the artificial airway. Patients with a tracheostomy often have difficulty clearing their own secretions effectively, which can lead to airway obstruction and infection. Suctioning helps maintain a patent, open airway, improving ventilation and oxygenation. Always use proper sterile technique to prevent infection. Question 15. When educating a patient about preventing hospital-acquired pneumonia, which instruction is most important? A. Limit fluid intake to prevent fluid overload. B. Avoid all physical activity to conserve energy. C. Practice good hand hygiene and deep breathing exercises. D. Request antibiotics proactively before symptoms appear. Answer: C. Practice good hand hygiene and deep breathing exercises. This question emphasizes patient education for preventing common hospital-acquired infections, specifically pneumonia. The concept is about proactive infection control and lung health maintenance. Good hand hygiene prevents the spread of pathogens, while deep breathing exercises help keep the alveoli open and prevent the pooling of secretions, which can lead to infection. These two actions are practical, patient-centered, and highly effective in reducing the risk of pneumonia. Remember, prevention is always better than treatment. Question 16. What is the main characteristic differentiating emphysema from other types of COPD? A. Inflammation of the bronchi. B. Reversible airway obstruction. C. Destruction of alveolar walls, leading to enlarged air sacs. D. Excessive mucus production and chronic cough. Answer: C. Destruction of alveolar walls, leading to enlarged air sacs. This question tests your understanding of the specific pathophysiology of emphysema, a chronic obstructive pulmonary disease, COPD. The distinguishing feature of emphysema is the irreversible destruction of the alveolar walls and capillaries, which leads to abnormally large, floppy air sacs, alveoli, and a reduced surface area for gas exchange. This structural damage results in air trapping and difficulty with exhalation. While other COPD components involve inflammation and mucus, the alveolar destruction is unique to emphysema. This destruction impairs the lungs' ability to effectively transfer oxygen and remove carbon dioxide. Question 17. Which diagnostic test is primarily used to visualize the lungs and assess for conditions like pneumonia, fluid accumulation, or lung collapse? A. Electrocardiogram, ECG. B. Chest X-ray, CXR. C. Ultrasound of the abdomen. D. Magnetic resonance imaging, MRI, of the brain. Answer, B. Chest X-ray, CXR. This question focuses on common diagnostic tests for respiratory conditions. The keyword visualize the lungs and assess for conditions like pneumonia, fluid accumulation, or lung collapse points directly to the utility of a chest X-ray. A CXR uses radiation to create images of the heart, lungs, blood vessels, airways, and bones of the chest, making it an essential and quick tool for diagnosing various lung and heart conditions. It's often the first imaging test ordered when respiratory issues are suspected. Question 18. A patient is prescribed a bronchodilator. What is the primary action of this type of medication? A. To reduce inflammation in the airways. B. To thin respiratory secretions. C. To widen the airways by relaxing bronchial smooth muscles. D. To suppress coughing. Answer, C. To widen the airways by relaxing bronchial smooth muscles. This question explores the pharmacological action of a common respiratory medication. A bronchodilator is a medication specifically designed to relax the smooth muscles surrounding the airways, bronchi and bronchioles, causing them to widen or dilate. This action improves airflow, making it easier for patients to breathe, especially those with conditions like asthma or COPD where airways are narrowed. Understanding this primary action helps you anticipate its effects and side effects. Think of it as opening up a constricted tube to allow more air to pass through. Question 19. What is the main function of the diaphragm in respiration? A. To filter inhaled air. B. To produce vocal sounds. C. To contract and relax to facilitate breathing. D. To provide structural support to the lungs. Answer, C. To contract and relax to facilitate breathing. This question addresses a key component of respiratory mechanics. The diaphragm is a dome-shaped muscle located at the base of the lungs, and it is the primary muscle of inspiration, inhalation. When it contracts, it flattens and moves downward, increasing the volume of the chest cavity and drawing air into the lungs. When it relaxes, it moves upward, reducing the chest volume and expelling air. This rhythmic contraction and relaxation are essential for breathing. The diaphragm is the powerhouse of your breathing process. Question 20. Which term describes a bluish discoloration of the skin and mucous membranes due to inadequate oxygenation of the blood? A. Jaundice. B. Pallor. C. Erythema. D. Cyanosis. Answer, D. Cyanosis. This question tests your knowledge of common clinical signs related to oxygenation status. The keyword bluish discoloration of the skin and mucous membranes due to inadequate oxygenation of the blood directly defines cyanosis. This visible sign indicates a significant lack of oxygen in the blood, often observable in areas like the lips, fingertips, and nail beds. Recognizing cyanosis is a critical assessment skill, as it signals a serious underlying respiratory or circulatory issue requiring immediate attention. Question 21. A patient with chronic bronchitis is likely to exhibit which of the following symptoms? A. Sudden onset of high fever and chills. B. Persistent, productive cough with mucus. C. Rapid, shallow breathing with hyperventilation. D. Sharp chest pain that worsens with inspiration. Answer, B. Persistent, productive cough with mucus. This question focuses on the classic clinical presentation of chronic bronchitis, a type of COPD. Chronic bronchitis is characterized by inflammation and irritation of the bronchial tubes, leading to an overproduction of mucus and a persistent, productive cough that lasts for at least 3 months a year for 2 consecutive years. The body tries to clear the excessive mucus through coughing. This distinguishes it from acute infections or pain. Understanding these hallmark symptoms helps in identifying and managing patients with chronic respiratory conditions. Question 22. What safety precaution is most important when caring for a patient receiving oxygen therapy? A. Ensuring the patient ambulates frequently. B. Placing no smoking signs prominently. C. Administering sedatives to prevent restlessness. D. Restricting fluid intake to prevent fluid overload. Answer, B. Placing no smoking signs prominently. This question emphasizes a crucial safety aspect of oxygen therapy. Oxygen, while essential for life, is a highly combustible gas that can vigorously fuel fires. Therefore, the most important safety precaution is to prevent ignition sources, such as smoking, open flames, or sparks, near oxygen equipment. This measure significantly reduces the risk of fire and ensures patient and staff safety. Always remember that oxygen and fire do not mix. Question 23. A patient demonstrates Kussmaul breathing. What is a characteristic feature of Kussmaul breathing? A. Irregular, shallow breaths followed by periods of apnea. B. Deep, rapid, and labored breathing. C. Slow, regular, and very deep breaths. D. Short, gasping breaths with inspiratory pauses. Answer, B. Deep, rapid, and labored breathing. This question assesses your knowledge of specific abnormal breathing patterns. Kussmaul breathing is a distinct pattern characterized by very deep, rapid, and often labored breaths. It is typically the body's compensatory mechanism to excrete excess carbon dioxide and correct metabolic acidosis, such as that seen in diabetic ketoacidosis. Recognizing this breathing pattern alerts you to a serious metabolic imbalance that needs urgent medical attention. Think of it as the body trying to blow off acid very quickly. Question 24. Which condition is characterized by a collapsed lung due to air accumulating in the pleural space? A. Pleural effusion. B. Atelectasis. C. Pneumothorax. D. Hemothorax. Answer, C. Pneumothorax. This question tests your understanding of specific lung conditions. A pneumothorax is a condition where air accumulates in the pleural space, the space between the lung and the chest wall, causing the lung to partially or completely collapse. This can happen spontaneously or due to trauma. It differs from atelectasis, which is the collapse of alveoli, and pleural effusion, which is fluid in the pleural space. Recognizing this condition is critical as it can be life-threatening. Question 25. What is the primary role of mucus in the respiratory system? A. To facilitate gas exchange. B. To warm and humidify inhaled air. C. To trap foreign particles and pathogens. D. To produce vocal sounds. Answer C. To trap foreign particles and pathogens. This question focuses on the protective mechanisms of the respiratory system. Mucus, produced by cells lining the respiratory tract, plays a vital role in defending the lungs. It acts as a sticky trap for inhaled foreign particles, dust, pollen, and microorganisms, preventing them from reaching the delicate alveoli. Cilia, tiny hair-like structures, then sweep this mucus upwards towards the throat to be swallowed or expelled. This mucociliary escalator is a crucial defense against infection. Think of mucus as your body's internal flypaper for airborne irritants.